Hello, this is a specimen of the heart, and you can see that we're looking at the left ventricle, or rather we're looking into the left ventricle, which has been opened. This is the ascending aorta, the aortic valve, and the mitral valve here with the chordae tendineae, and down at the inferior aspect we can see the papillary muscles. And this is the free wall of the left ventricle. Posteriorly, we are able to appreciate the right ventricle, which has also been dissected open, and this is the tricuspid valve with the corresponding chordae tendineae, the pulmonary artery, and the pulmonary valve. Now let's focus on the area of abnormality, which is in this region. We will zoom in and we can see that the aortic valve is very abnormal. There are some of these brownish looking materials that are attached to the cusps of the aortic valve. We call these vegetations, and the reason they're brownish is because they are admixed with some blood, but there is also fibrin, and on the microscope we will see neutrophils as well as perhaps some microorganisms. This is an example of infective endocarditis where there are vegetations on the valve cusps. So what could possibly happen in the acute phase is that these vegetations can actually dislodge, travel in the systemic circulation via the aorta, go down into any of the organs or distal sites, and this will result in septic emboli in sites that are distant. So there can be multiple foci of infection elsewhere in the body, for example in the kidneys or even possibly in the brain. Further down the line, when these lesions are eventually treated with antibiotics, the infection is cleared, there is residual damage to the valve cusps, and there can be resulting valvular regurgitation or valvular stenosis, or even both occurring at the same time, because there's usually scarring by fibrosis. So this is infective endocarditis with aortic valve vegetations, and usually the vegetations in infective endocarditis are rather large compared to vegetations in other conditions such as systemic lupus erythematosus.